Good evening, ladies and gentlemen, and welcome to yet another amazing topic. In fact, this topic is something that has given people sleepless nights, literally. I'm going to be talking about insomnia, and I remember my humble self, Lucky, Dr. Drugs. And without much ado, let's just get right into it, okay? Yeah, Dr. Drugs. So, table of contents goes thus. You see, without understanding the reason why people have insomnia, the solution may be very elusive, all right? So we have to start from the root cause of the problem. And we have to start from the root, in quotes, location of the problem, which is the brain. So we'll talk about the human brain briefly. We'll talk about what is sleep. And what does, we don't even know what sleep is. We'll talk about things that have to do with sleep, like parts of the brain that have to do with sleep, like the pineal gland and the rest. We'll talk about insomnia itself, its types, its signs and symptoms, causes and risk factors, complications, diagnosis. How common is this condition, right? We'll talk about that as well. Then what diseases provoke insomnia? Because a lot of people get the treatment wrong by giving solution to the problem on the outside while leaving the main cause of the problem active inside, okay? And of course, prevention and treatment of insomnia is not left out. What are the challenges involved in management of insomnia? Chemical intervention that we normally use, then of course, side effects. Mind you, there are some naturally occurring biomolecules, we'll talk about that can help against insomnia. And we'll have to also talk about the foods that cause insomnia, foods that help promote good sleep, and the importance of natural pharmaceuticals in the management of insomnia. We're going to be quite fast because of time. And of course, we're going to be having our interactive session coming up immediately after the seminar as usual. So, the human brain. The human brain is a complex organ that controls thoughts, emotion, movement, and vital body functions. But there are different parts of the human brain that help to control sleep. Now, there's something called the hypothalamus, and in the frontal part of that hypothalamus in the brain is what we call the suprachiasmatic nucleus, or for short, let's just call it the brain's clock. All right? Now, what it does is that it helps us to regulate our sleep-wake cycle by releasing hormones like orexin and all that help to regulate the circadian rhythm. Circadian rhythm is the internal clock mechanism that helps us to stay awake and sleep regularly, okay? Now, the pineal gland is stimulated by is controlled by the suprachiasmatic nucleus in the hypothalamus, and that is where melatonin, this melatonin people are swallowing like chin-chin, that's where melatonin is being produced. Guess what? The suprachiasmatic nucleus, or the brain's clock, is what actually signals the production of melatonin from the pineal gland, which now helps us to fall asleep. You see the link there, right? The unique thing about this brain's clock, or suprachiasmatic nucleus, is that it can actually detect light. Okay? Now, we have what they call the retinohypothalamic tract, okay, that directly receives sunlight from our eyes and goes straight to that suprachiasmatic nucleus to tell us when there is sunrise and sunset. That is why when you are holding your phone in front of you, you are signaling your suprachiasmatic nucleus that it is still sunrise when you are actually pressing your phone around 12 midnight. And that can actually provoke or promote insomnia. So that's just one of the causes of insomnia. We just had to talk about that because we're talking about a group of things around the brain that helps us to regulate sleep. So I had to bring that in. Okay? Watching TV late at night will send light rays that will be detected by the retina. We go through the retinohypothalamic tract and tell the brain's clock that it is still sunrise. And that can disrupt our sleep pattern. We'll get to that shortly. Now, the brainstem, of course, manages sleep transitions between stages and all that. Of course, the thalamus and the prefrontal cortex also have functions that have to do with sleep, all right? We talked about the pineal gland. The reason why it's important is because a lot of us are very familiar with this thing they call melatonin. People just buy in pharmacy and just throw in their mouth and they're chewing like chin chin. Your brain actually produces melatonin, so be careful. Anything that comes from outside and the body produces it inside will suppress the production of what the body produces on the inside, making you need more and more. We'll get to that shortly. Now, you see, in response to darkness, the brain's clock, that is suprachiasmatic nucleus, tells the pineal gland to increase melatonin production. That's why you see that when we tell patients that are having insomnia to stay in a dark room without TV or phone or anything, cool, dark room, what are we trying to do? We're trying to signal the pineal gland to produce more what? Melatonin. Okay? In fact, the pineal gland is essentially the body's internal night switch. Okay? So this is how all these things come together to, make us sleep. So melatonin lowers alertness, reduces body temperature slightly, and prepares the body for sleep. Okay? Now, this melatonin itself, let's just take note of these words. Okay? Now, melatonin is a hormone produced in the pineal gland and synthesized from the biochemical precursors. Listen to number one, tryptophan. For those that like eating turkey, just go and Google one of the essential amino acids found in turkey. You see that Google will most likely tell you tryptophan. And of course, 5-hydroxytryptophan, 5-HT, is now, which is virtually in short, in quotes, serotonin, and that serotonin is now converted to melatonin. Can you believe that there is a popular fruit that we all enjoy that has tryptophan? Now, remember that when you give the body the precursor to something, it will most likely, if need be, turn to that thing that is made from that precursor. So that means if you take something that contains tryptophan, you find out that it will go through this process, produce serotonin, and serotonin will be converted to melatonin, and then you see that the person will begin to fall asleep. And guess what that amazing fruit is? Banana. Now, let's not bore ourselves with all these scientific terminologies. Of course, like ANAT, that's the aryl alkyl amine N acetyltransferase, and all this long grammar we don't want to bore ourselves with. So let's just understand that melatonin is essential for what? Activating that night switch, courtesy of its production by the pineal gland. All right? You see, if you look at the bottom right corner of the screen, you will see the brain with a clock around its neck. You can see the heart and the sun all interacting together to help us regulate our internal 24-hour clock that makes us sleep. Okay? So the circadian rhythm is the body's internal 24-hour clock that regulates sleep-wake cycles, hormones, temperature, and daily biological patterns. It is controlled by the what? Suprachiasmatic nucleus, or the brain's clock, in the hypothalamus. It responds to light signals from the eyes to determine when the body should feel awake or sleepy. During sleep, the body cycles through non-REM and REM stages. All right? Now, a well-aligned circadian rhythm ensures smooth, repeated transitions through these stages, resulting in refreshing, high-quality sleep. Anything that affects the circadian rhythm will affect sleep. And anything that affects sleep will affect a lot of things in the body we're going to talk about shortly. So what is insomnia? Insomnia is a sleep disorder characterized by difficulty falling asleep, staying asleep, or waking up too early and being unable to return to sleep. But guess what? Despite having the opportunity to rest. You know, some people don't have the opportunity to rest, and that's why they're not resting. For instance, if somebody is on a night shift in the hospital, for instance, you find out that you are not allowed to sleep. And of course, the patients will keep coming. And the fact that you did not sleep during your night shift does not mean you have insomnia, because you did not have the opportunity to rest. But you can imagine someone that has the opportunity to rest and just turning around like those people that roast corn on the roadside, turning like corn that they're roasting on the roadside, left, right, left, and it's not sleeping. Then you find that that person most likely has insomnia if this persists. Okay? So what are the different types of insomnia? A lot of people have insomnia without even knowing that they have it. That's why you may be surprised that more than half of the people you know on this earth are having insomnia. Or let me say more than half of the adults you know are having insomnia. Because there are different types and there are different combinations. Okay? Now, we can classify them by duration. That's the first classification. Now, if it's short term, that means it lasts a few days or weeks and is often triggered by stress, illness, or life changes. You know, for instance, the kind of amount of money somebody can just receive, bam, $4 billion. Sleep can just disappear for some time. Because you think, what did I do with all this money? After some time, it just goes off. Person starts sleeping again. Okay, I don't talk about the opposite, which is somebody losing his job or something. Let's not go there. Now, then we have the chronic or long-term insomnia. All right. Now, this persists for 3 to 6 months or more, occurring at least 3 nights per week. That means we can confirm that somebody is having chronic insomnia if the person has been having it for about 3 to 6 months or more, and at least 3 nights per week. Okay, that is types of insomnia by duration. That's identifying the types of insomnia. And we're talking about the one that is involved with duration. Now, let's go to the one that is can be defined by cause. What cause something caused it. Now, we have primary insomnia. It's not linked to any other health condition. That's the sleep disturbance is the main problem. With nobody knows why the person is not sleeping. Checked everywhere, no problem. Sometimes in quotes, maybe village people are at work kind of thing. But actually, it's just enigmatic, all right? Then we have the secondary insomnia. Now, this occurs due to another condition, such as depression, like those that have had heartbreak. So some women will be crying till morning because their boyfriend has left them. That one is secondary. You know, when a new boyfriend comes, you see that the girl will start sleeping well again. Then we have anxiety, chronic pain. For instance, those that are having peptic ulcer disease that is burning this, that is, it's as if the bleed coming from the depth of their stomach and they are unable to sleep. We have hyperthyroidism. This makes people hyperactive because of the high amount of thyroid hormones. Some medications can actually provoke insomnia. Then substance use. Imagine somebody sniffing cocaine and say, want to go and sleep. You must be joking. Hypertension, diabetes, and guess what? Obesity provokes insomnia. That's what people do. That's why sometimes when people call me and they say that they're having insomnia, and I listen to their story, what's their history. Once I find out that the person is obese, we usually start from there. Once the patient starts to reduce weight, the sleep starts to come in some cases, can start coming in some cases. Now we have types. One of the types or way we can classify the types of insomnia is by pattern. This one is very important. So guys, listen. We have onset insomnia. These are people that find it difficult to fall asleep. They can turn round and round and round the bed, but when they fall asleep, they will sleep. So they may find themselves sleeping around 12 or 1 or 2 a.m. All right? Then we have another class of people that have maintenance insomnia. Those are the ones that they slept around 9 like normal people, but they must wake up in the night around 2 or 1 and stay awake till around 3 or 4. Then they don't sleep again. And when they wake up, they feel as if they never even sleep and they'll be even tired more sometimes. Okay? So it's often, maintenance insomnia is associated with trouble staying asleep or frequent awakenings. Now we have terminal insomnia. You find somebody that slept around maybe 9 o'clock and then for an unknown reason, person wakes up by 3:30 a.m. There's no incomplete sleep. Or your sleep back problem. You understand? Person cannot sleep till morning. That's terminal insomnia. You see that by the time you go through these different types and subtypes of insomnia, you find out that many people you know on this earth are having insomnia. Even you may have been having insomnia before without knowing. You understand? But guess what? There's even more. Sometimes we can have a combination of these kind of challenges. I had a patient yesterday that called me and he was having secondary maintenance insomnia. That means his insomnia, luckily for him, was linked to his weight, his blood sugar, and blood pressure. So you see, secondary. You understand? And guess what? His problem is not as if he can't fall asleep. He must wake up in the night till morning. That is spiritual night vigil. Night vigil with nobody. You understand? You know? Until you wake up like that till morning before he may not try and sleep again. every time. So that's why he's having what we call secondary maintenance insomnia, because we know the reason why and we know the type of insomnia is also maintenance insomnia. This part is very important, so I hope we took very good note of it. Now, these are the signs and symptoms of insomnia. In case you don't know you have insomnia, or your friends don't know they have insomnia, these are the types, the signs and symptoms of insomnia. Difficulty falling asleep despite feeling tired, waking up frequently during the night, waking up too early, feeling unrefreshed after sleep, daytime sleepiness or fatigue, poor concentration and memory, irritability, aggression, anxiety or depression. Increased errors or accidents. Many of the road traffic accidents you know were caused by poor sleep. Headaches, and guess what? Gastrointestinal discomfort due to stress. Those that are having what is called irritable bowel syndrome, insomnia worsens it, because irritable bowel syndrome has a strong link with the gut-brain axis, and stress increases irritable bowel syndrome. This is just to mention a few. Now, what are the causes and risk factors of insomnia? Stress and emotional distress, we talked about that. Poor sleep habits, that is nighttime excessive urination, that's nocturnal polyuria. Mental health disorder, especially those that are having anxiety, depression, bipolar disorder, attention deficit hyperactivity disorder, those that have children that are autistic, that have ADHD, and of course autism spectrum disorder. You can testify that the children wake up in the night, can be screaming and they won't sleep, and the parents too may not sleep. Mental conditions, chronic pain, asthma, gastroesophageal reflux disease, peptic ulcer disease, hyperthyroidism, obesity, sleep apnea, restless leg syndrome, and a lot of other issues like that. Different medications like steroids, and let me make you people laugh a little. Benzodiazepines. Do you know a lot of people take benzodiazepines to help them sleep? Examples of benzodiazepines include diazepam or Valium. Then we have bromazepam or Lexotan. You understand? We have clonazepam. But let me make you laugh. Do you know that one of the causes or risk factors of insomnia is that drug that they're taking to counter the insomnia? It's like, that's it. So people say, well, I'll be like bicycle. Then, of course, antidepressants, stimulants, certain antihypertensive medication. When somebody having hypertension and you're taking hypertensive medication, and the hypertensive medication is making you not to sleep again. Hey, God. Then guess what? Even that one they used to calm children down, they call methylphenidate. They give to children that have attention deficit hyperactivity disorder. One of the side effects is what? Irritability, and that can lead to what? Insomnia. So you can see that the drug they're trying to give the child to calm down to sleep, the child is also part of the problem. Sometimes practitioners, I don't know how. But anyway, let's just leave that for another day. Menopause, okay, is a problem. Heart diseases, you find a lot of patients that have insomnia, telling that their heart used to skip beats sometimes, and they feel pain in their chest, angina pectoris, they have signs of myocardial infarction or heart attack and all that. Sometimes even the body, when the body detects that there's a problem somewhere, the body too wants to stay alert to know. God is powerful. Imagine your body trying to stay alert to be sure that there's no problem. You understand? So that's why when some people feel as if they're having a life-threatening challenge, they can't sleep, because their own body will be keeping them awake so that they don't go and sleep and go to the land beyond. Now, substance use, of course, caffeine, nicotine, alcohol, and all that. Brain damage, poverty, hopelessness, and loneliness. Imagine somebody going to the hospital and saying that you cannot sleep, but you don't have up to 200. Okay, let me just say, you don't have up to $1 in your account. $1 is not in your account. And the person is a married man with 7 children. So how will you sleep? So that's where poverty comes in. The hopelessness, you understand? Like loneliness too is another issue. Stress hormone like cortisol. Being female, women are more, have a higher tendency to have insomnia, because a lot of things are going on in their bodies, man. We don't want to go into that aspect, okay? We have a lot of things going on. Trust me, if it's not menstrual cycle, it's menopause. If it's not menopause, It's pregnancy. If it's not pregnancy, it's marriage, something, it's hormonal this or hormonal that. So I don't know. I guess that's why women have the tendency of having this challenge more. Okay. Of course, older age, genetic predisposition, of course, poor sleep hygiene. People that are working shifts are not left out. High stress lifestyle, like I aforementioned, night shifts, jet lag. Imagine somebody that is moving from California to Nigeria. I know it's like 8 hours time difference. You understand? That means if when other people are sleeping around maybe 10 p.m., the person's suprachiasmatic nucleus is still programmed for afternoon in California. So the person will stay awake. You understand? So that's what jet lag can do to that person. Then of course, smoking and household stress. Of course, urban neighborhoods where you wake up in the morning, somebody that is living near a traffic junction, like that one that is close, that one that is between Aromire and Allen Avenue or something. That junction is very big. If you are living near there, in the morning, the horn and the cars and the trucks, you don't need alarm anyway. Just know that the street will wake you up. You understand? Then, of course, complications of insomnia, daytime dysfunction and chronic fatigue, reduced work or academic performance, impaired memory and concentration, accidents, especially while driving. It's better when you are driving and you get tired. When you get to a filling station, just buy fuel and just go to one corner. Tell the manager you want to put on your AC and just sleep very well. Better you sleep in fact, if possible, if the journey is still far, just book a hotel around there, park your car and just go and sleep. You understand? It's better. Then depression and anxiety disorders, increased risk of cardiovascular diseases and lifestyle diseases like high blood pressure, diabetes, and so on and so forth. Can you imagine that high blood pressure, diabetes, and so on and so forth can cause insomnia, and insomnia too can cause them? Wow, that's what we call negative cooperation. Then we have weakened immune function. Lack of sleep can weaken immunity. Impaired memory, focus, and learning ability. That's why it's so sad that when these children that are having intellectual disabilities have autism and they also have ADHD, you find out that the ADHD may not allow them to sleep, worsening the autism. Can you imagine? So you see. Now, impaired special relationship. You see that the irritability and all that can actually strain people's relationships, hormonal imbalance, slower reaction time, and so on and so forth. So these are just some diseases that provoke insomnia. We have like stroke, Parkinson's disease, Alzheimer's disease, epilepsy. Imagine somebody sleeping peacefully and having seizure from sleep. It's terrible. Migraines, traumatic brain injury, anxiety disorder, depression, bipolar disorder, post-traumatic stress disorder, obsessive compulsive disorder, fetal alcohol spectrum disorder, heart failure. Remember, your brain can wake you up and say, guy, there's a problem in your heart. Don't sleep, stay awake. So that problem. Hypertension too is not left out. One of the symptoms of hypertension is insomnia. Okay? Then congestive obstructive pulmonary disease, COPD, asthma, obstructive sleep apnea, pulmonary fibrosis, obesity. Look at it there. Hyperthyroidism, gut dysbiosis and dysfunction. Remember that the gut produces a lot of biomolecules that help to promote or regulate sleep. About 90% of, yes, a typical example is serotonin. About 90% of total body serotonin is produced in the gut. And that serotonin, remember, is what is converted to what? Melatonin. Okay? Then we have other important biomolecules that are also produced in the gut there that help to regulate sleep. Can you imagine? And that's why you see that when we have special children that have ADHD, there's a kind of way the child will behave, and I'll tell the mother this child is having gut dysbiosis. Once we tackle the gut dysbiosis, the child begins to sleep better. You understand? Because the bacteria we're now giving, there's a kind of we use some kind of very good probiotics to resolve it, and it's also similar to adults too. There's a kind of restlessness an adult will display. We start by arresting or addressing gut dysbiosis. That is just how. Solving the matter from the root cause is very important in tackling insomnia. Now, diabetes is not left out. Of course, we know that it can cause too much frequent urination at night. Then the blood sugar fluctuations can interrupt sleep. There's high blood sugar that can damage delicate blood vessels and nerves in the brain. Especially those ones that are going to the suprachiasmatic nucleus and those that are going to the pineal gland, essential parts of the brain that are necessary for sleep. You can see that these damages can actually affect sleep. Menopause, hot flashes and night sweats can cause problems. Cushing syndrome, because Cushing syndrome is strongly linked with high stress hormone levels, that's cortisol levels. Of course, adrenal disorders are not left out. We've talked about esophageal reflux disease, peptic ulcer, irritable bowel syndrome, liver disease, arthritis, and so on and so forth. You see, all these things can actually lead to what? Insomnia. So this is how we diagnose insomnia, okay? It's mainly clinical, based on history and sleep patterns, all right? But that's where we have problem, because the first person that diagnoses insomnia is the patient, oftentimes. So it's often sad that some patients don't even know they have insomnia. Do you understand? Or when it begins to start. So it's the patient that goes to the hospital and says, I'm not sleeping well. Do you get? So that's where there's a very big problem, you know? So, but finally, when the patient lands, duration, patterns, and all that are checked, sleep diary, questionnaires, and what we call polysomnography is also not left out, an actigraphy. Now, just know that people are not sleeping in this part of the country. Forget this thing that you're seeing here. This is the one that was measured. What about those that are not measured? What about those women that are crying in the night? Every night they are crying, they are awake. What about those men that are looking at the ceiling, thinking about their family, their job? In fact, in this part of the world, if you don't stay awake and you're a man, you're not complete, sort of. So it's everywhere, but we still need our sleep. Like seriously, a lot of things are going on. You slept last night, fuel was 700, 750. You wake up in the morning, they're saying it's 1,004. Some years back, we all slept peacefully. Fuel was around, was it 3 something? We woke up in the morning, it was around 1,002 or 1,001. You know, a lot of things happening. You know, while you are sleeping, a lot of problems are coming up. You wake up in the morning, you meet them, the next night you're not sleeping again. You enter your bus from Festac to Lekki Phase 1, your fare was about 3,000 naira. You were lamenting that it was formerly 800. Then you now slept and woke up and the night that is 5,000 from nowhere. You see? So a lot of things are affecting people's mind. That's why this topic is very important. You may be looking at your neighbor, thinking that this your neighbor is enjoying and you are suffering. But if you can open that your spiritual medical vision or something and see what is going on in that person's head, I'm gonna forget. If you check closely, you may find 2 devils holding 2 forks like this, pointing at that person's head. Like things are happening. That's why we need to be conscious of our sleep. It's very important. Okay, look at this is a typical example of what I'm talking about. You see this person now. This is how a lot of people's heads are. But you may not know. Unless they come and sit beside you or come to your office and start telling you their problems. In fact, you find out that some people, money is not even the problem. But problems, too much problems is the problem. I don't have to explain it. So please, guys, let's be watchful. If you know you have a friend that you know is not sleeping, if you notice even myself, maybe you are always calling me around 12 midnight and I'm awake, please tell me to go and sleep too. You know, let everybody try to get some rest. You understand? A lot of things are going on. Now let's talk about prevention and treatment. Lifestyle and daily habits. Maintain consistent sleep schedule. Don't sleep 8 p.m. today, 11 p.m. tomorrow, 6 p.m. day after tomorrow. You'll be sleeping different 2 a.m. because you are not able to maintain a good circadian rhythm. It's a problem. Try to get morning sunlight. That sunlight that strikes you in the morning, you know, every morning I send a message to everybody to go and do the exercise. It's best you do it outside. I know we have the technology to have the machine you run on in the house there, but that natural light that you experience when you are jogging outside is very important because it will tell your suprachiasmatic nucleus that what? It is morning. All right? Now, avoid daytime naps longer than 20 to 30 minutes because if you sleep too much in the daytime, you will not sleep well at night. Exercise regularly. Avoid heavy meals close to bedtime. Limit caffeine reduce alcohol and nicotine use or avoid it completely. Now, respect your sleep environment. Some people don't have respect for their sleep environment. If you leave some people, they will put 72-inch TV in their bedroom. The light alone is as if they're in a studio where they're shooting a movie. Then you now have all sorts of phones. You look at this one, look at this one, look at this one, look at Facebook, what's it, TikTok, Instagram, YouTube. And you're just telling your brain that it's still daytime. That's what you're telling your brain. And then later you say you don't know why you cannot sleep. Please be careful. So keep your bedroom cool, dark, and quiet. Use your bed only for sleep and intimacy. Okay? No TV, phone, or eating. Bear in mind that intimacy is also very good for sleep. It helps to improve sleep. A lot of people are having what they call hysteria. Just go and Google hysteria and Google how hair practitioners used to counter hysteria in those days. You'll be surprised that lack of intimacy can actually provoke insomnia. You find that there are some women, once they just entangle with their husband, even they were not sleeping since before, just turn and check, they have slept off. The man too, after some time, you sleep off. So you can see that in quotes, entanglement is very important for sleep and countering insomnia. Take note of that, guys. Now, make your mattress and pillows comfortable. Then remove bright screens and gadgets from the room. Then guess what? Nighttime routines are also important. So you have to avoid screens at least an hour before bedtime. Of course, cognitive behavioral technique. Like there were 3 terrible cases we had not too long ago. 3 bad cases. Trust me, the way we tackle these cases, there's one of them that if they're giving the guy injection like this for sleep, and the guy is awake. Now, his friend was taken from one hospital to another. It was now, he had not slept for a long time. And you know when people don't sleep for a long time, they die. You understand? So it was now an emergency. When they go in hospital, they try, he still can't sleep. His friend took him to hospital until he came to us. And guess what we discovered? This young man, he's an Igbo man, he has money, young boy, hardworking. We had some things that actually provoke insomnia. Number 1, stress. The guy is a hustler to the core. You understand? He started from scratch. He was somebody's, what they call shop boy. From there, he grew till he became a rich man. You understand? A young man. Number 2, he had high blood cholesterol. He had peptic ulcer disease. He had hypertension. He had one more thing, type 2 diabetes as well. But the hospitals he was going to were busy treating insomnia. So when he came, I told him, I said, look, we have to start from AA before we go to BB. You know, before we finish, we start tackling these things one by one. One by one. And by the time we finish tackling this condition, or this guy's condition, can you imagine that this guy started sleeping? We have not even fully entered the main insomnia matter. The guy started sleeping. That means they were treating the outer part of the problem. But there was one thing I told him one day when he started sleeping. He said sometimes he used to, like, he'll be waiting for the sleep, it won't come. I told him something that changed his life. I said, mind your business. He said, I said, no, not mind your business in that time. Mind your business. You cannot mind your business and mind sleep's business. Allow sleep to do her job. You have your job to do. Sleep does not disturb you. So if you are waiting for sleep, she may never come. Just mind your business and let sleep mind her own business too. And everybody will be fine. Do you know that this guy starts sleeping in the afternoon? So anyway, that's just another thing. So now try sleep restriction therapy. And of course, challenge negative thoughts. Some people always say themselves, I cannot sleep. People in my family don't sleep. Even our goats don't sleep. Mosquito in my village don't sleep. Our king, nobody sleeps. That mentality already, you're already telling your brain, you're already suppressing your suprachiasmatic nucleus from inside. You understand? In fact, you are like a house divided against itself internally. So you cannot stand. So you must have to cancel that thing from your mind completely. Treat underlying conditions, review medications that may that may disrupt sleep. Use melatonin cautiously and appropriately. Some people have abused melatonin to the extent that it's no longer working. Okay, now we have valerian, chamomile, and all that. Then see a health practitioner if symptoms. Don't forget use of natural pharmaceuticals, and of course, avoid unwanted behavior or bad sleep manners. Avoid them. You understand? And remember that you don't fall asleep. Relax and stop waiting for sleep. Mind your business. Okay? You understand? Avoid intense exercise or stressful conversation late at night. Some women, they will not bring that quarrel to their husband until when the man is one. In fact, he's so sleepy that as he's opening this eye, this one is closing, this one is open. Then that's when they'll start saying, that time we are at the filling station, we are at that marketplace. I heard you call one woman baby. Who is that baby? Who is that baby? Around 12 midnight. You had all day to nag or quarrel. Same thing with some men. You know, is it that in the night you remember that there was too much salt in your food around 11 p.m. when the woman is tired and she's already snoring? You say, I'm talking to you and you're sleeping. 11 p.m. Please have good sleep manners. All right? You don't have to quarrel at all. But is it that time that you know that you're going to quarrel? Wonder shall never. We will hear a lot of things. If I wait, as a practitioner, you will hear things. You will start by settling certain things that are funny. Let's not go there. Now, avoid using your phone in bed and so on and so forth. Okay? What are the challenges in management of insomnia? Some people underreport insomnia. You understand? They will not tell you the full story. You get? And some people are Sabinus. You know, they're telling you that they're giving you the signs that they're having insomnia. If you tell them that you're having insomnia, they'll tell you that they're not having insomnia, that they sleep. If you're a person, but you said that you woke up around 3:30 a.m. and you could not sleep. But I slept from 11 to 2. I slept now. That's a big problem. Misdiagnosis is not left out. Okay? Don't forget that when you are diagnosing insomnia without checking the root cause, is misdiagnosis. That's if you are diagnosing, saying the person is having only insomnia without checking why. That's wrong. Now, we have to rely on patients' information. And you know that a lot of patients don't give information. Even though statistics will say that about 42% of people are not sleeping, it's more than that. A lot are not sleeping, but they have not even come to report. Okay? Poor adherence to behavioral strategies, resistance to lifestyle changes, physiological dependence on sleep medication. Some people believe that if they don't take that sleep medication, they can never sleep. So once they put their hand on their container and that can of melatonin is empty, they just put their hand on their bed and say they are finished. They can't sleep. Who told you that you cannot sleep? Now, coexisting mental health issues, yes, chronic stress, side effects of medication, then of course limited access to trained therapists, incomplete response, okay, then short-term relief with drugs versus long-term behavioral solutions. Some people are having their problems attached to their behavior, but rather than solve their behavioral problems, no, they prefer, Africans, sharp. If you put anything in a bottle now and say if you drink one bottle, you will sleep well. You in fact, all you need is just to start bringing some people that come and be lying that they were sleeping after taking the bottle. People will be knocking on your door that they need it. You understand? Rather than go home and relax and solve all the problems that are causing insomnia. Okay? Noisy or disruptive sleep environments, shift work, cause cultural beliefs or misconceptions about sleep. Some people that are having insomnia they must join 12 midnight prayer. I told my patient, I said, you cannot be trying to solve insomnia and you're joining 12 to 1 midnight. Who told you that witches only fly around 12 midnight? It's 12 midnight here, but it is 12 noon on that place in the world. And God of the day is God of the night. My brother, go and sleep. Go and sleep. When you wake up, it's still the same God that was in. God does not have morning shift or afternoon shift or night sleep. He doesn't sleep. So go and sleep and pray in the morning or pray before your sleep time. It's your faith that matters. It's not the timing. You understand? Now, cultural beliefs or misconceptions about sleep, poor knowledge about insomnia, and lack of root cause solution. People are solving the surface and abandoning the root cause. So these are the kind of things people chew, like chin chin. You can see the benzodiazepines. You can see the Zaclone and all that, Zopidem, Zopiclone, and S-Zopiclone. We have the melatonin receptor agonist and so on and so forth. This is just to give us an idea of a few things that people chew for sleep. Now, this side effects, I don't want to emphasize on this. I don't so that you don't disobey your health practitioner, but bear in mind that all drugs are poison. Or it's just a function of quantity, you understand, and quality. All drugs you know on earth are poison. That's one of the first things you'll be taught in the pharmacological, medical pharmacological aspect. Now, there are some naturally occurring biomolecules against insomnia, all right? But please, don't go hunting for them. Sometimes the places where you find these biomolecules, you may have other destructive biomolecules in such places as well. Consult your health practitioner and or your nutritionist, all right? At least to support you so you don't go astray. You know? Now, melatonin is naturally occurring. Gamma-aminobutyric acid, serotonin, we've talked about that, adenosine, cortisol, dopamine, acetylcholine, that helps with the parasympathetic axis, that the calming axis of the central nervous system, and also is very active during REM sleep and so on and so forth. Histamine, tryptophan, L-theanine, glycine, magnesium is a cofactor for gamma-aminobutyric acid receptors. Potassium is important, calcium is important, vitamin D is important. Okay, but use the appropriate vitamin D. Don't just go and buy any vitamin D you find anywhere and say you're taking vitamin D, because it helps to promote production of melatonin and B6 and also B vitamins as well are very important, and so on and so forth. So these are some natural occurring biomolecules. Many practitioners actually know where you can find them. Don't go hunting for them on your own. So let's talk about the foods that provoke insomnia, because some people notice that after eating, sometimes they don't sleep. Caffeine-containing foods, alcohol, high sugar foods, fatty or fried foods, spicy foods, foods high in tyramine, because this tyramine will lead to production of norepinephrine, which activates the sympathetic axis. That's the axis that triggers what? The central nervous system, okay, which is the opposite of the parasympathetic axis that is calm. That's the calming axis that is stimulated by acetylcholine. You can see that epinephrine, norepinephrine, the catecholamines help to activate the sympathetic axis, which makes people more active, alert, and awake. So you can see why tyramine is not so nice. Excessive fluids will make you urinate too frequently. Energy drinks and all that are not okay. High protein meals before bedtime. Artificial sweeteners, of course. Monosodium glutamate. Now, glutamate is a stimulating, it stimulates the nervous system. Okay, gamma-aminobutyric acid counters, that is, calms the nervous system, while glutamate stimulates. In fact, you find that your drugs like gabapentin or pregabalin that are taken by people that are using, that are having lumbar spondylosis and all this kind of cervical spondylosis and all that, those drugs are actually analogs of what? Gamma-aminobutyric acid. Okay, that's why I tell patients that those things are almost completely useless, because they just suppress the nerves for a while, and after some time the pain comes back. That's just on that is topic for another day. Then we have high processed foods, foods containing nitrites and nitrates, foods in omega-6 can be inflammatory. Then citrus fruits can actually trigger those that are having ulcer and all that. You see that some herbal teas every minute. Most people cannot sleep, you just go and start drinking herbal tea. You know that if you drink herbal tea that contains what's that in ginseng, it can make you have insomnia. Yeah, so people don't even know. There's certain kind of herbal teas you're supposed to take. Except those that contain chamomile, it's better, right? Those that contain lavender, those that contain things like that are very good. But chamomile is one of the most potent of them all. Now we have things that contain excess iron and so on and so forth. Now, what about foods that promote good sleep? Now, foods rich in tryptophan, foods high in melatonin, foods rich in magnesium. You know, magnesium actually is a muscle relaxant as well. So you see, it's very nice. And of course, it supports gamma-aminobutyric acid receptors. Then foods rich in calcium, omega-3 fatty acids, foods rich in the B vitamins, especially vitamin B6, and so on and so forth. You can see them, legumes as well. Nuts and seeds are not left out. So now, dairy products are not left out, but be careful, But you find out that milk, yogurt, and cheese, because they contain a good amount of can contain tryptophan and also some kind of gamma amino butyric acid aspects. See, that's also important. Certain fruits can help. Bananas, remember, of course, herbal teas that contain chamomile, as aforementioned, and so on and so forth. Dark chocolate in moderation. Not say because they said that dark chocolate is good, you start swimming inside or use it to do pillow at night. No, be careful, and so on and so forth. So, what are the importance of natural pharmaceuticals in management of insomnia? You see that these natural pharmaceuticals are very important in the sense that they have no side effects. They may not be as fast as you want, but if you use them appropriately and are patient with them, you will get what you're searching for. Now, they support or help to calm the nerves, counter obesity, regulate circadian rhythm, counter gut dysbiosis and dysfunction, promotes production of important sleep biomolecules. They help in weight management. Similar to countering obesity, they help to improve sleep generally. They help to prevent or treat diseases that provoke insomnia, provide minerals and molecules for sleep, prevent oxidative stress, manage depression, prevent, manage, and treat cardiovascular conditions that can make people stay awake. Supply adequate nourishment for optimal sleep and health, and so on and so forth. Okay. Now, what I want to show us is I'm not saying that these are the things you must use, but I like giving examples because I don't like being a jack of all trades, master of none, number one. And number two, there's no need changing the working system when you are using something and it's functional. Most times, for many reasons or many kinds of issues, I just like using forever living products because they have been here for a long time. And I've come to realize that they seem to be the most reliable source of biomolecules around. But guess what? You can get your biomolecules from anywhere you like. Okay? But if you're my patient, this is what I will give to you. And of course, people that come to us, we attend to them ourselves and we give them products by ourselves. Okay? That's how we operate. Now, we talked about acetylcholine. This royal jelly contains choline, which is a precursor of acetylcholine. This contains EP and DHA, very essential for brain function. We know what we're talking about. So, this contains somatic stem cell stimulants that can help to replace damaged parameters that are essential for sleep, especially in the brain. This contains chamomile, as well as catechins and epigallocatechins that are very, very important for sleep. This will help us to reduce weight. It's a 9 days weight loss and detoxification program, which I often extend to 30 days and help to counter obesity that has a direct link with lifestyle diseases that provoke insomnia, as well as cardiovascular conditions that also provoke or promote insomnia. All right. Now, for gut health, I give this amazing probiotic. Okay, contains bifidobacteria and lactobacillus species. Okay. Then, of course, this is calcium. But I like this calcium because it's dicalcium malate. It stays longer in the blood than the other regular calcium. This is vitamin D that I know works for a lot of people. Then this also contains calcium and other natural occurring minerals and vitamins that are very essential for general well-being and sleep. It also contains calcium, but for younger people, I give this one because it has other benefits attached to it. This will help against cardiovascular conditions, and of course, as a bonus, it also helps to power the mitochondria or the powerhouse of cells, especially those in the brain and around that area that is necessary for sleep. Of course, this contains acetylcholine, which is a more potent form of real choline, especially when we're talking about depleted acetylcholine. In fact, for severe cases of intellectual disabilities like autism and a lot of other issues like dementia and all that, this is what we use to support our patients. So, before we move on to the next segment, I want to say you are what you consume. So let me just leave us with this. there is a constant battle between factors that repair and protect our bodies and those that break it down. So we have to be on the winning side. Your food may be killing you. Take it or leave it. A lot of people are having insomnia today because of what they put in their mouth. Okay? Remember not to adjust medication or dosage without the guidance of a trained practitioner. Prevention is better than early detection. The choices you make today will determine how healthy you will be tomorrow. And also, aging is not a disease. It only needs maintenance. Sleep is medicine. Thanks so much for coming. Remain blessed. On this note, thank you so much, guys, for being here. You've been an amazing audience. Good night and God bless. Bye.